Hi folks, I'm John Thornton with the Pain Cure Clinic, where we teach people how to cure their chronic pain. And check out our new video masterclass, which is a complete step-by-step guide to getting pain-free. This episode is all about the nocebo effect, which may be hindering your effort to stop your chronic pain. The opposite of the well-known placebo effect is the nocebo effect. That's where a patient is given wrong information that their condition is worse than it actually is, and lo and behold, the patient's health actually gets worse accordingly. It's very common, and I'm going to show you how it applies to chronic pain, and when you really understand it, you'll be able to cure yourself permanently. But let's first look at some examples of the nocebo effect so you can see how powerful it really is. A recent study showed that 79% of medical students report developing symptoms suggestive of the illnesses that they're currently studying. The student health clinics even have a name for it. It's called med-studentitis, and this nocebo even includes diseases like leprosy, malaria, and even dung fever. It doesn't seem to matter how likely the disease is. When they're reading about it, the students think that they have it. In one cancer study, the control group for a new chemotherapy drug was given nothing but saline, yet they were warned that it could cause hair loss. 30% of that group lost their hair. In another chemotherapy study, the control group inhaled harmless saline, but they were told it might cause them to throw up. 80% of them vomited in the first 2 hours. In a study published in the Pavlovian Journal of Biological Sciences, 34 college students were hooked up to monitors and then told that an electrical current was being passed through their heads and were warned that it might cause headaches. Although not 1 volt ever passed through their heads because the machines were never turned on, 68% of the students reported headaches. That's nocebo. A case study described a psychiatric patient with split personality. As one personality, the patient was not diabetic. However, the moment she became her alter ego, she believed she was diabetic, her blood sugar levels rose, and she literally became diabetic. And I've got tons of these examples, and I could go on and on. This stuff is fascinating, but what's the point here? How does this relate to chronic pain? Well, the point is twofold. First, all these examples show that a belief only can cause real medical problems without any basis, and those problems can be immediate and they can be dramatic. And secondly, these examples show that human beings are incredibly susceptible to the power of suggestion, and that power is increased when the suggestion is given by someone of high authority, like a doctor. The medical establishment's inability to offer the correct diagnosis, tension myositis syndrome, leads to the nocebo effect all the time, and here's how that happens. Let's look at an example. A patient, we'll call him Michael, presents to his primary care doctor with back pain. With little or no deliberation, Michael is sent for an MRI and then to an orthopedic surgeon. That surgeon uses the MRI to identify disc abnormalities and then recommends surgery. So, just like the medical student who thinks they have malaria, this patient now thinks that they have a serious problem with their discs. Both conditions do not exist. But Michael embraces the erroneous diagnosis. The surgery doesn't work, but now Michael has accepted the nocebo as fact. And here's the worst part of all. Michael may never recover from a disease he never had. This is the nocebo effect, and in Latin, nocebo means I shall harm. And that's the opposite of the Hippocratic Oath, but that's what doctors are doing to chronic pain patients all the time, probably you. Don't fear, the solution to the nocebo effect is very, very easy. Just understand that whether it's TMJ or IBS, those are just erroneous labels created by the medical establishment so that they can standardize care, create drugs, and bill insurance. Whatever symptoms you have, just understand that it's no big deal. Your symptoms are not chronic. You just need to shift your focus away from things like discs and towards reducing your stress level. And as I say to my coaching clients all the time, remember, there's really nothing wrong with you. That's it for this episode. If you like this episode, please hit the subscribe button below and check out our coaching options at paincureclinic.us. There's a link below. And thanks for watching.